Welcome everyone joining us today for another Hub 101. My name is Imani Moore, and I'm the engagement coordinator for the Austin Community Hub.
Hi, I'm Zenobia, and I'm the Community Resource Coordinator for the Austin Community Hub.
Thank you. Now, I just want to go ahead and start by introducing a little bit about who we are and what we do. The Austin Community Hub was designed to be a dedicated space where we can engage with the members of our community. So we're here to serve as a connection between Austin residents and all of the services that are offered by ACT's network of partner organizations such as childcare, job training, youth programs, legal assistance, and much more.
Each one of our Hub 101s gives you all the opportunity to get to know our different partners and get live answers to your questions. Hub 101s take place twice a month on Zoom and Facebook Live.
Thank you. Okay, let's get down to business. Today, we are joined by Melissa Crutchfield, Director of Communication and Engagement from PCC Community Wellness Center. And she's here to talk about all the great work that they do. We'll end with a Q&A session after the presentation. So feel free to drop any questions you have in the Q&A box on Zoom, or if you're in the chat, or drop them in the chat if you're watching on Facebook Live. And once again, thank you for being here. Thank you, Melissa. I'll pass it over to you, and the floor is all yours.
Awesome. Thank you so much, Imani. I want to thank Zenobia, Imone, and Clara for having me, for Austin coming together, for hosting this hub. This is a great resource, and I'm so glad that I know about it now because I will be showing up and listening. I just wanted to thank all the residents of Austin and the other nonprofit organizations that all work together to continuously make Austin an amazing place to live and work. So a little bit about me. My name is Melissa Crutchfield. I am the Director of Communication and Engagement at PCC Community Wellness Center. I also have been doing work for quite a while around healthcare and health equity on the west side of Chicago. I sit on the Community Advisory Committee for Westside United. I'm on the board of directors for Chicago Coalition to End Homelessness, and this is my passion. And so I'm super excited to work for an organization like PCC, who is dedicated to improving health equity. A little bit about PCC. We're a nonprofit healthcare organization, also called an FQHC. So FQHCs provide low-cost safety net medical services to underserved areas and are funded by federal grants. So PCC specifically, we provide comprehensive healthcare and support services to the West Side communities of Chicago and the near West suburbs. We began in 1980 as the Parent and Child Center, which consisted of a 3-room clinic at West Suburban Hospital that offered prenatal, postpartum, and in-fact care for underserved residents of Chicago's Austin community. Go ahead, next slide, thank you. So our mission at PCC is to improve health outcomes for the medically underserved community through the provision of high quality, affordable, and accessible primary health care and support services. We are anchored with family medicine, but we are committed to serving the needs of all people in all stages of life. In partnership with our providers and staff, we offer quality medical service to the medically underserved in the community to improve outcomes and eliminate health disparities. It's our belief that though we serve a very specific geographical area, it is our responsibility to share our models of success with our local and national partners in service with an ultimate goal of improving the health and well-being of our communities. We do not stand alone. So what that means is there are FQHCs all over Chicago and the country, community health centers dedicated to this idea that everyone deserves access to care. And so we take people who don't have insurance, and we have a sliding fee scale option that makes it possible for anyone to walk in and get care. Next slide, please. So the pillars of PCC come down to 5 things. So we really try to focus in on these 5 things when we think about our organization. The first one is community engagement. And so that's part of my role, it's also why we're here. We understand and know that no one standalone organization is going to shift the tide in any neighborhood across the country, that it takes all of us working together, listening to one another, sharing with one another best practices, and supporting one another to achieve our mission of access to quality healthcare. Quality, you've heard me say it quite a few times. We as an organization believe not only do the residents of Austin and the neighboring communities deserve to have healthcare, they deserve to have high quality healthcare. And so that's part of who we are. Growth. We know that if we don't have enough buildings or services, then we can't give access to people who really need it. Finance falls under making good, being good stewards of our finances at every turn. And then workforce development. What we'd really love to see is, people that work for PCC to grow with the organization. And also in the neighborhood, we understand the link to workforce development as an aspect of health and wellness. We understand that everything that happens in the exam room is extremely important when we think about health outcomes, but without access to other services, it doesn't do much. Go ahead to the next slide, please. So I'm just going to talk a little bit about our services. Next slide, please. So PCC offers a myriad of services. We have children's health or pediatrics, adult health, oral or dental health. We have Austin Recovery Connection, which is an amazing program that we will have out of our new building for people who are struggling with addiction or chemical dependency. We have mental health services. We are one of the only organization or community health centers that offers not just behavioral health, but also psychiatry. Specialty care. We're extremely excited, and I'll talk a little bit more about the specialty care options we have in just a little bit. Women's and prenatal health. So that includes labor and delivery. And then our birth center. Our birth center is an extremely special place, and we'll talk a little bit more about that in just a minute. Next slide, please. So some of the things we're going to talk about today, some of our spotlight programs, are things that are kind of coming up soon, and so we want you to know about them, or things that have had some changes recently. So we're going to talk about VeggieRx, our diabetes workshops, our birth center, cardiology, and mental health services. I'm going to start a little bit farther down the list. Can we go back one? I'm going to start with our cardiology. So what was formerly the Austin Family Clinic, PCC's Austin Family Clinic at 5425 Westlake, has now become our dental and specialty clinic. We're really excited about this because what we'd like to do is shift from the idea of a standalone clinic to a campus. What we want to do is offer services that community residents would usually have to go out of the neighborhood for or go to a hospital for, more and more to this campus. So we are currently accepting patients at 5425, and St. Mary's will be our provider there, giving cardiology services. You can always call our general line to get more information on that. But we're super excited about having cardiology in that building with our dental clinic that has always been there. Our goal is to, over the next few quarters, add more specialty services that you may not find in other community health centers, so that people in Austin have access to those services directly and don't have to leave the neighborhood. The second piece I'm going to talk about before we go to the next slide is the birth center. The birth center is located at 6201 Roosevelt. It's a really special place. So there aren't very many places in the city of Chicago where you can have a very home-like setting for your birth. So our midwives, PCC midwives, run this, the birth center. And once you become their patient, you can labor there, The rooms are built like your home bedroom, and there are large tubs if you want to have a water birth. PCC's dedication to birth equity and the ability to give women from every walk of life options, or birthing people from every walk of life options, is extremely important to us. If a person who's going to have a child from Austin wants to have a water birth, that should be something that is accessible to them. If they want to labor away from a hospital, that should be something that's accessible to them. The birth center does transfer high risk. So if there's any issue, they transfer high risk patients to St. Mary's currently, or McNeil. So those are the people we are partnering with, and currently we're delivering at St. Mary's, and we are working on our partnership with McNeil. So we're super excited to be in partnership with St. Mary's currently. And then the third thing I'm going to talk before we go to the next slide is our mental health services. Most of you probably have went down Lake Street and seen our beautiful new building, 5461 Westlake. It is an amazing space. And in that space, there are 3 floors, and the middle floor has our Austin recovery side, and then it also has mental health services. And on that floor, you can go outside. There's an outside aspect to it. There's a walking track. It's a beautiful space. But inside, we will be hosting things like support groups. You'll have access to psychiatry. You'll be able to see your behavioral health providers all in this beautiful new building. We just know that the residents of Austin deserve high quality access to mental health services in a beautiful space. And so we're super excited about that. So we're going to go ahead and move to our Veggie RX and Diabetes workshop. So go ahead and switch. So I'm super excited to talk a little bit about Veggie RX. This also will be taking place in our new Austin Family Health Center on Lake Street. We also have another site up at Salud on Fullerton, another one of our clinics. And so what Veggie RX is, starting February 19th, which is tomorrow, all of our PCC patients can come in and pick up a free box of fresh produce every week. It's first come, first serve, and you can get 1 box per PCC patient. So let's make that clear. It's 1 box per patient and not per family. So if you have multiple PCC patients in your family, you can all come in and get a box of produce. That box usually contains both fruits and veggies. And those fruits and veggies come from our own farm that's located right on our campus on Lake Street, that we partner with Chicago Botanic Gardens Windy City Harvest to maintain, amongst other places. And if you have diabetes, you can stay after Veggie RX, and there's a diabetes support group. In this 90-minute group, you'll not only get your box of veggies, you'll get to take part in a group discussion that's led by a social worker or a nurse to learn more about diabetes and how to manage your stress. You'll have a brief medical appointment, including getting your blood sugar checked and your blood pressure checked, and then you'll participate in group cooking demonstrations once a month. There is transportation assistance available. So just go ahead and give us a call. The number is 773-537-0025. If you have any questions, you don't need an appointment, but if you want to, you can call to make an appointment. Go ahead and switch to the next slide. Another thing that we're super excited about coming up is at the end of March 29th, at our new building, in our fitness room, we are going to be having yoga, and it's going to be accessible for anyone who is pregnant or postpartum or just a parent. We know that the process of pregnancy and childbearing and child rearing can be so stressful. So we want to come together, talk a little bit about that, and do some yoga. This is free to all participants. You can come at 1 or at 10 o'clock or at 2 o'clock. We have 2 sessions. I actually will be joining. I'm a certified yoga instructor, and I will be there as well, helping out. But it's just a really good chance to be in a space with people who are going through similar situations as you and get some free yoga classes in order to learn to regulate your nervous system a little bit. All right, next one, please. Next slide. So sometimes people think that, oh, the Lake Street is our clinic or Austin is our clinic, but we actually have 14 different locations located all over Austin and some of the western suburbs. Some of these locations do different things, such as on the right, you see our specialized locations like the birth center or the farm. We have a site at the Boulevard in East Garfield and at Sign Med School, and then our dental and specialty clinic. But the rest of our clinics are all clinics where you can get that basic family medicine care, that basic primary care that is kind of the foundation of who we are. Next slide, please. So this is what I'm extremely excited about. When we think about healthcare, we are really thinking about how we can expand our services to meet as many of your needs as we can in one central location without having to ride trains, buses, to go all over the city to get your care. So at 5461, the top right-hand corner is the outside of the front of the new building. It's a beautiful space. We know that our community residents deserve a beautiful space. We put a lot of time and thought and effort into what this building would look like, and it reflects how we feel about our neighbors. When you go into the first floor, what you'll see on the right-hand side is our family medicine clinic. So we have 24 exam rooms, a couple procedure rooms there on site where you can see your provider. We have nurses on staff, medical assistants, all working together to help you navigate your health journey and to support you as you walk towards wellness. If you take a left, you will walk into our wellness wing, which is something we're extremely excited about. Like I said before, we understand that everything that health and wellness cannot be encapsulated solely in the exam room. So as you see in the middle of the frame, you see a classroom. That's one of our wellness classrooms. We're extremely excited about it. That's where your diabetes workshops and your VegRx workshops will take place. But one thing we're excited about for this space is bringing in other community organizations who need a space to meet, who have services that might be great for our patients or our community residents. We all know it's kind of difficult to find good event space or meeting space in the neighborhood. And so this is a space that we really foresee working alongside our partner organizations to keep it full of classes and workshops that really benefit the community and our patients, all driving us in the direction of wellness. If you go to the second floor, the picture on the bottom right is a little dark, but that's the floor with our mental health and our behavioral health and our Austin recovery programming. The picture in the top middle is the walking track. It's very snowy now, but as you can see, it's a beautiful space where patients can go outside and walk on the second floor. You can see downtown, you can see the train, and it's just kind of another way we're saying we are focused on wellness. I forgot. The first floor is I forgot one of the most important things. So on the first floor, right next to this this classroom is a teaching kitchen. We just recently got a donor to bring in appliances. And so we have this beautiful teaching kitchen where we will begin to hold our diabetes cooking classes. But like the classroom, we'd like to really access what's in the community. So if you have ideas or thoughts about how other organizations or maybe small businesses could use the teaching kitchen to serve our residents, to be in service of our community residents and patients. You can always reach out to me, and if you all could drop my email in the chat, that would be great. You can email communications@pccwellness.org. But these two spaces specifically are ones we really foresee, not just PCC using, but other community organizations and entrepreneurs that may be interested in having a workshop or class at our space. The third space on that floor is a fitness room that we're very excited about. That's where our yoga class will be taking place. It's another space we'd like for you all to walk alongside us and really start to dream about what does our community and what do our patients want in this space? Do we want yoga for seniors in the afternoon? Do we want baby and caregiver classes? Do we want Zumba or line dancing? All of these things are activities that get people moving, and because of that, they point towards wellness. And so we're looking forward to having people in these three spaces. The picture in the top left corner is the farm. This is the view from the 5461 building. We grow our own plants here and our fruits and vegetables. And during the summer, you can come and purchase fruits and vegetables there. But also, this is where your produce comes from for our Veggie RX programming. In the bottom left corner, we see our dental and specialty clinic. This is where our new cardiologist services are located. It's where our dental clinic is currently, and it's where we look to add more services, potentially a physical therapy office here in our neighborhood. And all of these services will make up the Austin PCC campus that we're super excited about. Go ahead and go to the next slide, please. So I'm going to talk a little bit about our patients. I will say this. When I walk into the clinic, I see my neighbors. I see people who work at other organizations in the neighborhood. Our patients are our neighbors. They are community members. But as you'll see on the next slide, they come from all over. So go ahead and go to the next slide. So PCC in 2024 served 46,264 unique patients, so different people. And we had 153,669 patient visits. That's a lot of people to serve. 47% of those people were Black or African American, 34.9% were Hispanic or Latinx, and then we had a mixture of everyone else. The zip codes that people came from, 33% came from 60644, which is a big number. 29% came from 60639, and 20% came from 60651. That's where the bulk of our patients come from. That being said, we actually have patients from more than 50 zip codes. So we have a range of where people are coming from, but the bulk of our patients, as you can see, come from very close to where we're located. We had a few questions about if someone could come if they didn't have insurance. And the answer is 100% yes. As you can see, our patient population, about 58.5% have Medicaid and 14.8% have Medicare. But it looks like right here, 7.4% are uninsured. And then the 19.3% would be other. So we accept all types of insurance. There are a couple of insurances we don't accept, but when you come in to make your appointment or call to make your appointment, you just let the folks at the desk know what your insurance is, and they'll be very straightforward as to whether or not we accept your insurance. For that little piece of folks who are uninsured, that was one of the biggest questions I got. And we do have a sliding fee scale that goes by your income. much like many other places. And prices can range from very little to, $60 plus. But it all is based on your income. Next slide, please. So my role here is really around communication and being engaged with our staff and our patients and our community. And so two of the things that we really want to focus on going into this new year are being a presence and being in partnership with our community. When I say community, I think of Austin. I think of other organizations who are like-minded, focused in on advancing health equity. That is who we are, and that's actually why we're here. We're really appreciative of Austin coming together. We've been meeting with them recently about how we can better work together to serve the residents of Austin and move the needle on health outcomes and quality of life in our neighborhood. Next slide, please. So if you want to partner or you have questions about care, you can always contact me or the organization. So yes, my email is here, communications@pccwellness.org. But this is our general phone number, and you can call it for anything, for any questions or thoughts, and they will route you to the correct clinic or administrative person that you're looking for. Next slide, please. So I just want to say thank you for your time in Austin coming together for having us here.
Thank you. Thank you. Great presentation. We'll go ahead and move to the Q&A portion of the presentation. Please don't forget to drop those questions in the chat. And if you're on Facebook Live, please drop them there as well. We'll go into the first question, and that is, we'll start down here. Actually, okay. How does PCC differ from an urgent care clinic?
Yeah, you're kind of breaking up, but I can see the question. How does PCC differ from an urgent care or urgent clinic? Yeah, that's a great question because there's so many options out there. So an urgent care is a place where you go for a one-time, more emergency style situation. PCC is a place where we want to have a long-term relationship with you. We are the ones who you get to know, you build relationships with, you build trust with. We are the ones who we would be your primary care provider. So you would make an appointment, you come in, and you would always see the same provider. So you have a relationship with that person. That's the goal. We don't want to be always reactive in health. We want to be proactive. So we don't want to wait till you're so sick you need to go to urgent care. We want the first time that you feel like something may not be right, that you make an appointment with your primary care provider. And even when you feel great, coming in for regular checkups so we can make sure, like, check your blood pressure, check and make sure everything is good with you. So really the difference between urgent care and us would be urgent care is a little bit more reactive to what's going on, and we would love to be the place where we build a relationship that is proactive for your health. We're also thinking about all of your health journey. So urgent care is really like, oh, you broke your finger, we need to fix this finger. We are thinking about longevity and your overall health over the course of your lifetime. And even things like sports physicals for the kids, immunizations, all of those things, that's what we're here for. And then from us, from your primary care, if there were other issues, they would be the ones that would say, hey, so we're having some issues with your, some irregular stuff with your heart. I'm going to give you a referral to go next door to our cardiologist and get a checkup. So we're the ones who kind of are like the navigator, right? So we direct you like, oh, you may need to go to this specialist or you may need to see this person. And we think about your overall health. So you go to the urgent care, they're not going to say, well, next week I want you to go to Veggie RX and pick up some free produce because I don't think you have enough in your diet. So we're thinking wider. Mm-hmm.
Great. Thanks for that answer.
Thank you. So the next question we have is the workout facility accessible to the public?
That's a great question. And so the building is fairly new. We have not had any classes in it. The first one will be the Yoga Nidra class in March. But when the classes do start, it will be accessible to the public. We will encourage our patients and our community residents first, right? So if you see a doctor here or you live in the neighborhood, that will be our first priority. And then after that, it will be open to the general public. And we will really be seeking from those, what we consider our stakeholders, our community and our patients, right? What kind of classes we'd like to see in there. So if you do have any thoughts on that, please email me. We'd love to hear your thoughts on what kinds of classes you'd like to see in there. And just for clarification, it's not a gym. We're not going to have weights and stuff like that. It is a fitness space where we will be able to do different types of programming. We didn't want to lock it down as one thing because we know the weight rooms aren't necessarily accessible for everybody at every stage of life. And so what we wanted to do was to have a space where, one day we could have something for seniors, the next day we'd have something for young kids, and it could kind of be accessible for everybody, regardless of their stage of life.
Great. Thanks for that clarification. Great. And our next question. So first off, they're shouting you guys out. So it's a big shout out. PCC Wellness does incredible work addressing health equity and food access. The question is, they love to learn more about how PCC connects with local food providers, specifically with what opportunities exist for organizations like mine. And this is someone from Finding Justice, a flower and vegetable garden, to partner with PCC to provide fresh, nutrient-dense produce, such as our food is medicine boxes to patients and families in need.
Yeah, that's a great question. And it's very timely because it's about to be spring. We're going to start our Veggie RX programming tomorrow. So we're thinking about produce and local organizations as well. I really would love to speak to this person who asked the question directly to see more about what they do and how we could partner. What I really believe is that so my role is new. I've been here since August. And before me, there wasn't a communication and engagement person. But part of my role is to learn more about your organizations and see how we can partner. And so I'd love to have her reach out to me. That being said, I spoke a little bit earlier about the wellness classroom and the teaching kitchen. And what we'd love to do for an organization like that is to talk about what services are you already offering the community? Would the teaching kitchen be an asset to you? Would the classroom be an asset to you? How can we partner together with what we're already doing and you're already doing to expand our services for the community? So yeah, we'd love to talk. I would love to talk to him or her and really learn more about what they're doing. But the goal isn't for us to be in the teaching kitchen 24/7. It's to make it accessible for leaders in the community who have already been doing the work. We recognize that we are not the expert on growing, right? We are the expert on healthcare, and we don't want to be the expert on growing. We just want to highlight the people that are in the community. So we would love to have them in to talk and see what we maybe could dream up.
That's great. Someone asked, is there a fee for the RX program?
That's a great question. There is not. It is free to all PCC patients. You do need to be a patient, but it's free, and it goes from tomorrow to November 29th. So that's a really good chunk of the year where you're weekly getting those veggie boxes. And also, if you have any diabetes issues, it's really a great opportunity to get your blood pressure and your sugar checked regularly. And it's really quick. You're in, you don't have to like make a separate doctor's appointment. You come get your veggies, you do your diabetes workshop, and they will help you with transportation. So if you don't have a car and you live too far, call that number and they will help you set up transportation.
Oh, great, great. And for the question prior to that one, I'll be happy to connect you all, so you all can chat more and talk about what what the program offers. That's what we're here for. Woo, woo, we the hub. But while we're still on the Veggie RX program, and thanks for letting us know it starts tomorrow, so this is like perfect timing. Um, you mentioned transportation assistance earlier. Could you kind of speak more to that and how that process works?
Yeah, for sure. So I'm not in charge of the Veggie RX program, but I've been there when they're doing it, and I know that they help set up Ubers or Lyfts, something along those lines for their attendees. And I know the women in charge is amazing. So if you call and say like, I need help with that, they will help you set it up. Even if you don't have, this is the thing, you don't have to have experience with Uber. You don't have to have the app. You don't have to figure it out on your own. They will walk you through that. So don't let transportation ever be an issue for this program. Just reach out and they will walk you through how to get that handled.
Okay. Someone is asking what is the number for transport?
So if you can, it was on that flyer. So can you bring that slide back up? Is that possible?
Yeah, and if not, we can find out who's asking that question and make sure we get that
Here, I'll
information
bring it
to
up.
them.
Hold on one second. I'll find the exact phone number for transportation. 773-537-0025. So I'm gonna drop that in the chat.
Okay. Thank you for that. And while you're doing that, bring up the next question. Someone wants to know, do you need insurance to be a patient at PCC?
What was it? Do you need
Do
insurance to be a
you need
patient?
insurance to be a patient at
You
PCC?
do not. So this is the thing though. So if you want to be a patient here, you can come without insurance. You will have to fill in some information about your income so they can tell you what the sliding fee would be. If you don't feel comfortable with income information or insurance or that kind of information, like your more personal information, we will refer you to like how to apply for Medicaid if you want. But um, but if you don't qualify for Medicaid, you can still come, but you would have to use a sliding fee. It's very affordable, and it goes by your income. Does that answer the question?
No, that's perfect.
Great.
That's perfect. And let's see. Okay, yeah. Well, this is a personal question. So, I see all the different programs and the different sites that you all have, like catered to what it is that you may need as far as the resource you're looking for. Now, if I was to just walk into the health clinic, is there like a directory, so to speak, where you guys realize that I need this, or I may need to go to the birth center, or I may need to uh, go to the diabetes center? Like, is if I walk into one specific location, will I be pointed to different directions depending on what I need?
Yeah, for sure. So the good thing about our clinics is we have primary care providers at most of them. So you walk into a clinic, you get set up with your primary care provider, you make an appointment, and when you see them, they're kind of like your quarterback. So like they'll do all your vitals. So they'll see how much, your blood pressure and all the things, and they'll listen to you. And the huge part. Like, we have providers who listen, and they'll listen to you, they'll hear your story, they'll hear what about your health worries you, any issues that you've had in the past. They'll take all that information and they'll decide like what's next. Most of the services that you'll need for just general health needs, you can get through your primary care provider. But for anything that you need a specialist or a referral, they're the ones who will not only send you to a specialist when you get results, they'll look at them and they'll sit down with you and go through them with you and talk about next steps. So they're really your point of contact and kind of your, honestly, the person that you build the most trust with, and they're the ones that you'll continue to see over the course. They also have the most knowledge about the programs that are available to people who have whatever it is you are dealing with, be it anything from a free, like a cavity to you need physical therapy. Whatever it is, they will have all of the information, so they'll know where to send you on our campus, and they'll know if we don't have it on our campus. And we've already built relationships with other organizations so that, you know, we don't necessarily deliver high risk pregnancies at our birth center. But if you go to our birth center and that's where you start and something happens where you have a high risk pregnancy, we have a relationship with St. Mary, so that's where we'll take you, right? So we will make sure that you're taken care of for whatever you need, even when we're not doing it ourselves.
Yes, that's great. That's great. So one of the questions we do have is there availability for community members to rent out spaces or of that realm for like community events?
Yeah, for sure. So for community members, we definitely will offer our fitness focused things to patients and community members. And we'd like to do the same thing for any workshops we do. So I know we've talked about Austin coming together, coming and doing a workshop in our wellness classroom that would be open to patients and community residents. So what we want to do is really make our fitness, our wellness wing, a space where the community feels ownership, right? Feels comfortable coming in and saying, hey, what's going on in the wellness wing this week, right? Are there any cooking classes? Are there any, financial wellness workshops? What classes are we having? So we want the community to look at that space as with ownership and love and know that they're accepted and wanted there. And also, we would love to hear feedback so that, when we build out programming, it reflects what they want to see. And so, yeah, community residents and patients is what we're really thinking about serving, not just in the fitness space, but also in the teaching kitchen and the wellness classroom.
Well, great. Thank you for that answer. Have another question. This person wants to know, what is the average wait time for an appointment? How long would I need to wait?
That's a great question, and I don't know the answer. And the truth of the matter is the average wait time probably fluctuates depending on the season, right? So one thing I know, I've worked in the community health center arena for 15 years. One thing I know is that during school physical season, the wait time is much different than now, right? So it does fluctuate season to season, but what you can count on is when you come up and you come in to check in for your appointment, the patient representative that serves you will say, you know, thanks for coming in, and you have one patient in front of you, right? Like, so we can't promise that you're never going to wait, but we will do the work to make sure you know when you arrive how long your wait is. That's the part we can't control because it will fluctuate. There are certain times of the year where it's just longer than others. Yeah.
Oh, great. And I think you answered this before, but I'll go ahead and repeat. Are you looking for people to do the different exercises? And I'm guessing they mean, are you looking for different instructors
Yes.
to come in and host those fitness classes moving forward?
Yes. So we'd love to have folks from the general area who already teach classes be the ones who are teaching classes. So we are looking for folks who are interested, who already maybe have a little bit of a following, who have some experience teaching their respective classes, and that would be interested in doing something like this. So if you know someone who you love their class and they're, kind of in this general area, shoot them my information and we'll talk to them. We're looking to build out kind of a calendar of classes. What I thought you were going to say, and I forgot to say, so I'm going to go ahead and say it now, is we're also looking for staff. So if you know someone who's a doctor or a nurse or something along those lines and is looking for work, PCC is an amazing place to work, and there are tons of opportunities here and lots of room for advancement. So you can visit our website. Our website is old and we are in the process of updating it. So we'll be launching a new website in about a month and a half. But until then, you can go on our current website, pccwellness.org, and check out the jobs that are available. We are always hiring. And we love to hire locally as well. So.
Oh, great, great information. So you all hear that. And I'm sorry, I got another selfish personal question. Oh, wait, first off, I didn't know you were a yoga instructor. Thanks for letting me know. And please be sure to reach out when the men are able to participate in those classes. I'll be one of the first to sign up. But I heard you mention the birth center, which I had no idea you all had. Could you kind of plug that address again, and then
For sure. So
shamelessly, I was like, could you explain what a water birth is?
for sure. For sure. So a fun fact about PCC is we were the first birthing center in Illinois back in the day. So that's kind of like our foundation, right? Um, our birth center is located 6201 Roosevelt in Berwyn. It's literally right across the street from Oak Park. Um, and that space is a really cool space because um, we have midwives working it. So it's a less intrusive way of birthing. We also have doulas there. So I know you want to talk about water births. I want to say what doulas are and what water births are. So first of all, a doula is someone who assists you and supports you through your pregnancy and postpartum in your laboring before you give birth. And so it's just a really special thing to be able to have a doula. And right now, because of some of the changes in the state of Illinois, everyone that is birthing is able to get a care from a doula if they know that they can, right? If they know their rights, if they know what to ask for. And so our midwives are trained to make sure our patients know about their ability to access a doula. And also we have relationships with doulas. So we have doulas that we have relationships that will come in and work with birthing parents. The water birth is so a large tub, and you can Google it as well, but um, a lot of people choose to labor in water. It feels more natural to some people. Instead of like laying on a bed during labor, they might be in the water. Some people even give birth in the water. It's a very natural way of doing things. And while that doesn't work with every person giving birth because of different situations that they may have along the lines of like blood pressure or whatever, they may need to go to a hospital. For someone who wants to, we like to give them that option. And our midwives are there to support throughout the entire delivery.
No, thank you. That was very enlightening. I had no idea. I had no idea. So thank you for that.
Sure.
think that is all of the questions. We did have someone wanted to get in contact with PCC. Uh, so after this presentation wraps up, everyone that expressed interest in being in contact with PCC will do our job in connecting you all. And you will also be able to register for the next Hub 101 very soon in 1 second. So, and then, yeah, Zenobia, you'd like to add something?
Like we mentioned earlier, the hub is here to connect you to resources. Even if something isn't the right fit for you, as the community resource coordinator, I work directly with participants of the hub. So I'll be following up with you if you requested additional hub service and your registration form. My goal is to better understand what you're looking for so I can connect you with the resources or services you may need.
Thank you, thank you. And you could go ahead and register for our next Hub 101 right now, which will be on Tuesday, March 4th, 2025, of course. And this Hub 101 is entitled The Road to Success. And as you all know, we've been doing the anchor tenants for the Aspire Center. So this is another one of those anchor tenants. So please, please feel free to join in for our presentation with WHA, Westside Health Authority. Is going to be a good one. Please share this out with all your friends and family. You also can go on our Facebook page and check this out as well. And that I think that's all we have today. Hope to see you all soon. Again, thank you, Melissa. Couldn't express my gratitude anymore. Great presentation. I love what you're doing with PCC. And let's do this again sometime.
Thank you so much for having us. We appreciate you and all that you all do.
Thank you. Thank you. Until next time.